This is a great question. Why would they teach therapists to sit a certain way? So really what it all comes down to is body language. Without realizing it, the way we sit, the way we stand, the way we hold ourselves can put off different messages to people. And sometimes those messages don't match the words coming out of our mouth. So for instance, if I'm talking to you and I'm standing like this, I look like I'm more open and receptive to what you're saying. But if I'm standing like this as you talk to me, it probably doesn't look like I really care about what you're saying. My arms are crossed saying I'm closed off, my feet are pointing the same way as you are, and it really doesn't say I'm interested in anything. The same applies to how we sit in session. So the way they initially teach us to sit during our Counseling 101 classes, our first interview classes, is make sure we have an open posture with our feet flat on the floor and our body open, because this invites you to talk to us. And it does make sense, because you're not going to want to talk to me if I'm sitting like this, closed off. And a lot of us have a tendency to sit like this and with our arms crossed, and nothing about this screams, hey, I want you to talk to me and feel open with me. So we are taught to sit open, lean forward, be engaging, because we do care, and our body should reflect that. Now, that's where it starts getting complicated, is because we also want to look comfortable. So the way that works is, you start adjusting a bit. So yeah, we can sit like this. This is still open. And even when I start moving around this, I'm still open. And even if my arms are crossed a little bit, I still look like I want to talk to you. The whole time we're working in a session, we just want to really make sure we're not looking like we're closed off or not allowing the patient or client to be open and expressive as they want to be, just because we're accidentally putting off some type of vibe that we're not meaning to, all just because of how our bodies are positioned during the session. It all comes down to the comfort of the client or the patient. And sadly, that's not something that's always innate for someone. And that's why it's covered in most of our counseling or interviewing 101 classes. Because the first thing that matters in a session is that you guys feel comfortable. Because if you don't, we're not going to get anywhere. Thanks for the question. And if you guys have any more, keep dropping them in the comments and I'll answer the ones that I can.